Let's assume that you've exhausted your non-surgical options for shedding pounds and you've researched the different types of bariatric laparoscopic procedures that you can have performed, and you're determined and decided that you're going to go to Mexico to have your procedure performed. Now comes the question, who is going to perform my bariatric laparoscopic procedure? My name is Sheri Burke, and I'm with International Patient Facilitators in Mexico, and I'm here with Dr. Sergio Verboonen. Thank you very much for being here with us today. I'm going to ask you a few questions. I'd like to ask you a little bit about your studies and your background as a surgeon in Mexico.
Well, I am from the University National of Mexico City, and I did my residence in General Hospital. After that, I have many courses from endoscopy and then take a training in Lyon, France with Dr. Freddy. I have experience in all kind of procedures for bariatric. It could be LAPBAND, gastric sleeve, gastric PLICATIon, mini gastric bypass, or full bypass.
How long you've been performing laparoscopic bariatric procedures now?
Over 15 years. The intragastric balloon is a less invasive procedure, can do by endoscope, and take about 30 minutes for everything. The only problem is we need to take out the balloon in 6 months, the same way is by endoscopy. We don't need to cut, we don't need to do anything else. But majority of the patients have 2 or 3 days with a lot of nausea. And also the glow is not really excellent. After remove the balloon, the people usually gain weight.
Okay, so it's not one of your preferred procedures, the intragastric balloon?
Well, it's temporary, it's not permanent. But some people like to get this kind of procedure because it's not surgery.
Perfect. So it's the most minimally invasive of the laparoscopic procedures that we perform, or of the bariatric procedures that you perform, Dr. Verboonen.
That's true. The LAPBAND is a laparoscopic procedure, minimal invasive, and take about 20-30 minutes in the operation room. The people can get the glow. The LAPBAND is 100% reversed and have the system to be adjustable in case of the people is available to eat more. We can make a fill on their fluoro and the people can still losing weight.
Okay, so I think that the most important question that people have regarding the LAPBAND procedure, when we know it's a minimally invasive procedure, it takes approximately 30 minutes. Dr. Verboonen, what is the recovery like from, for example, the LAPBAND procedure?
Well, we have at this moment patients treated like ambulatory. We can do the procedure in the morning, and in the afternoon the patient can go to home or to the hotel, wherever they want to stay to recovery. Me personally, I get the LAPBAND in 2005, and I got my LAPBAND at 8 p.m. At 5 p.m. and I was on call.
Perfect. Dr. Verboonen, the question that people have now in their minds is, how do you know if you're a good candidate for the LAPBAND procedure?
Well, all the patients over 30 BMI are a good candidate for LAPBAND.
Okay. Dr. Verboonen, I think a lot of women ask themselves that, will weight loss surgery affect my ability to become pregnant in the future? Could you please respond to that question?
It's not true. The patient who lose weight can get pregnant at any time without problem.
Perfect. Thanks, Dr. Verboonen. I think that at this point it's very important also that we talk a little bit about the vertical sleeve gastrectomy, or the gastric sleeve procedure that we perform. I know that this is also a very important, it's a newer procedure.
The advantage of these procedures is we remove the fundus of the stomach, where is the ghrelin secretion. And the ghrelin secretion is the hunger. If we don't have ghrelin, we don't have hunger.
So that
is the advantage of the gastric sleeve.
So this used to be considered the first stage of a 2-stage surgery. Was first the gastric sleeve, and after the gastric bypass was required. I hear today that the gastric sleeve procedure is a standalone procedure. Is that correct?
Yes, that's correct.
Dr. Verboonen, let's talk about one of the newest procedures that you perform. You were the first surgeon in Mexico, the first bariatric surgeon in Mexico to perform this procedure. And this is, I think, one of our most popular procedures today, and it's called the gastric sleeve plication procedure. Can you tell us a little bit about this procedure?
Well, usually all the people would like to get a new procedure with not cut, with not take out nothing from the body.
So this procedure, there's nothing removed during this
No.
procedure?
We just made a little plication in the same part of the stomach, like the gastric sleeve, but we don't cut, we don't staples. We only make a plication of the same stomach and fold the stomach and make stitches out.
So,
This kind of procedure is a really new.
so this procedure, there's no cutting and no stapling, and the stomach is folded onto itself and sewed in place. Now the question is, how many of these procedures have you performed at this point?
At this moment, over 200.
And how are your results? How are the patients reacting after this surgery? How is their results?
Well, all the patients are happy after 2 or 3 weeks. They are still losing weight, but the only problem is 2 or 3 days with a lot of nausea. I want to be honest, and I want to share that the persons who want to get a gastric plication surgery need to be focused to have a nausea. We're going to apply some medications, IV, and also give the guidelines to resolve this problem for the person.
I think many patients know also at this point that the gastric plication procedure is still a relatively new procedure, and there's no long-time statistics or long-term statistic. Is that correct, Dr. Verboonen?
That's correct. We don't have a long-term results already. Well, I really love the mini gastric bypass, or BAGWA, like it's called in Spain. In the mini, we make just one function, the gastric anastomosis. And this is a low-risk bypass. And also have the combination of a restrictive, because we make a small pouch, and that's we have a two systems to lose weight, the restriction and the malabsorptive. I really love the mini gastric, or BAGWA.
So the mini gastric bypass is actually a reversible procedure. While it offers restriction, it's also a malabsorption procedure. Is that correct?
That's correct.
And could you explain a little bit about the gastric bypass that is I guess the gold standard in bariatric procedures?
In the full bypass, we make two functions. One is the gastric anastomosis, and another one is the anastomosis. But there's no difference between the full bypass and the mini gastric bypass. The results for long term are very similar.
Dr. Verboonen, what is the recovery like for our patients after a mini gastric bypass or full gastric bypass procedure?
Well, they usually need to be 2 days in the hospital and another 2 days in hotel or recovery house.
Okay, I think another question that's very important to patients are, before any of these procedures, what types of medical tests do we perform before any of these procedures?
Well, for all the people, we need to have a lab work with hemogram, chemical test, and type, coagulation times, and urine analysis, EKG, X-ray, and also a full evaluation for internal medicine specialists.
Do you do this with your patients in Mexico?
Yes,
All of the pre-op testing is performed in Mexico with your team, Dr. Verboonen?
absolutely.
Okay, Dr. Verboonen, let's talk a little bit about post-op testing. After any of our cutting and stapling procedures, which is the vertical sleeve gastrectomy, the mini gastric bypass, or full gastric bypass procedures, what types of post-op testing do we do?
Well, we do one test transoperatory with blue methylene and with air. If everything is correct, we finish the procedure. And we wait 48 hours in order to start liquid, and we start liquid with blue. It's the first testing. And we check the drain. Is there no glue? We can do the second test, is a fluoroscopy test with a contrast solution. and we can determine how is the liquid going to the small stomach, and is there no leak, is there nothing bad, we can start the liquid diet or immediately.
Dr. Verboonen, I'd like to thank you very much for being here with us today. And
Thanks to you, Sheri.
no, and this is Sheri with International Patient Facilitators. Thanks very much.
You're welcome, Sheri.